Aloha, and thank you for joining me today. My name is Dr. Catherine Taketa-Wong, and I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians, like medical doctors, we must attend a four-year medical school. We're trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals, just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. I use personalized food recommendations, as well as vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before we begin, I just wanted to let you know that if you have health conditions that you'd like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. This is a 15-minute strategy session where we can talk about your condition and come up with a plan to be able to help you the most. So arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. Okay, let's get started. And please feel free to use the comment section to ask questions as the talk progresses. So today's talk, we're talking about pain. And pain, unfortunately, seems to be a part of the human condition, and back-related pain in particular, but there's all different types of chronic pain that people experience. Chronic meaning that people experience pain on a regular basis. And some scientists believe that it's due to the fact that we walk upright instead of on all fours, in particular with relation to back pain. So at any rate, people have sought relief from pain since ancient times. And today, the approach of conventional medicine involves the use of various drugs, from the over-the-counter medications like ibuprofen and acetaminophen to strictly regulated opioids like oxycodone and morphine. And many people are familiar with the opioid crisis in terms of the crisis that we're facing with people having to deal with addiction and unfortunately, many unfortunate situations where there tends to be overdose and other kinds of issues. So that's one of the unfortunate things that is a side effect in terms of some of these pain medications. So particularly with opioids, I think it's well known that they have a higher risk of addictive properties than some of the other pain medications. And so some of the other medications like ibuprofen and acetaminophen, things that are available over the counter, I mean, people think of them as very benign drugs, and certainly not as dangerous as opioids or some of the other pain medications that are available by prescription only. However, one thing that's important to realize, even about some of the over-the-counter medications like ibuprofen or acetaminophen, is that they do have to be processed through the liver. And so the liver has to be able to break down these drugs and get it out of the body. And one of the concerns when people are dealing with chronic pain, meaning that they have pain constantly on a regular basis, and so they often have to take these pain medications like ibuprofen or acetaminophen on a very frequent basis. Some people are taking very high doses, the maximum dose that's recommended on the label, on a daily basis. And there are concerns with liver toxicity if people use these drugs on a very frequent basis. Most people don't realize that acetaminophen actually is very toxic to the liver, or acetaminophen or Tylenol. And so basically Tylenol, I mean, you know, if given just once in a while, usually is tolerated by most people pretty well. But Tylenol specifically, what it does is it decreases glutathione, and glutathione is one of the most important antioxidants in the body. So glutathione is made by the liver, and glutathione is very important in helping to decrease inflammation and also with getting toxins out of the body. but it's very, very important for our body to have normal levels of glutathione. And acetaminophen, what it does, the way that it's toxic to the liver is that it decreases glutathione. And so if people have, if people have a condition where they're taking acetaminophen on a regular basis, then that could suppress their levels of glutathione further and further and further, and in the long run actually could make their inflammation worse because it's suppressing glutathione, which helps to decrease inflammation. There are also a number of patients that have certain kinds of conditions where their body already has trouble making enough glutathione. So that's a very common thing that I see, for example, in autism and in some other conditions where people may have genetic mutations or other kinds of things where their body has trouble making glutathione. So I see this commonly in people who have a lot of inflammation in the body on a regular basis. And when they come in and I test their glutathione levels, even if they're not taking acetaminophen on a regular basis, like I mentioned, particularly children with autism or other kinds of conditions, where they come in and they test their glutathione levels and we find, oh, their glutathione levels are already abnormally low. And then some of these individuals, if they take acetaminophen, it could be more toxic than for other people because their glutathione levels are already really, really low. And so taking acetaminophen or Tylenol for some of these individuals could actually be very dangerous because they already have levels of glutathione that are too low, and then acetaminophen lowers it even more. So just keep in mind that, while we think of things like ibuprofen and acetaminophen as very benign, it's important to realize that taking them on a regular basis, on a daily basis especially, can actually be very harmful to the body, particularly, like I said, the liver. So my approach to treating pain with natural medicine involves many different things. I'll use Chinese and Western herbs. I also use homeopathic medicines and acupuncture. I do want to emphasize, however, that I'm not opposed to the use of pharmaceuticals when they're necessary, because some people really do have severe conditions where they have very severe pain. And so, often I will have people that say come in with a chronic condition, say like migraines, and they're taking pain medications all the time, or women that come in with really severe menstrual cramps or pelvic pain, or we have some people that come in with chronic back pain or other types of chronic pain. And so, I'm not opposed to the use of pharmaceuticals, but what we'll often do is we'll start implementing some of these kinds of things where we start using homeopathics or herbs, or often changes in diet can really make a big difference in terms of many of these conditions where people are dealing with chronic pain. And so often making those changes will start to help people reduce the need for the dose of pharmaceutical medications. And so often I find that people come in, and if they're on chronic pain medications and we start implementing dietary change and all of these other things to really try to address the root causes of what's going on, then we find that often people are able to reduce the dose of the medication that they need. Maybe they still need to take their pain medications, but we find that, they're able to take less. For example, I have a patient, a gentleman who's in his 70s, and he has a chronic back condition, and I've been working with him for many years, and we found that using regular acupuncture as well as a number of other kinds of herbs and dietary and lifestyle changes, he's been able to reduce the dose of the opioid medications that he needs to take. He still needs to take them, but we've found that he's been able over time to reduce the dose that he needs. So that's just one example. And so we'll also be bringing on another patient today. We'll be talking with her directly, and she's going to just share some of her experience in working with me, and we've used a number of different things to be able to help to manage her pain. So another thing that I like to use is CBD oil, and so that's cannabidiol oil, and we could have a whole Facebook Live just on cannabidiol products and CBD products. So many people are familiar with them, they've heard of them, and it's gaining a lot of popularity. But I found that that's something that can help to decrease inflammation. And there's some very interesting studies on CBD oil. So CBD is, again, it's a cannabidiol oil. So if you haven't heard of it, it is derived from cannabis. But CBD oil is basically hemp oil. And to be sold as hemp oil, then one of the things that we do is that we use the CBD oil, and that is something that can help to decrease inflammation. But basically, the CBD oils that are sold over the counter, they have to have 0.3% THC or less in order to be sold as hemp oil, where it's not considered to be a controlled substance. So THC, if you're not familiar with it, THC is the component in marijuana or cannabis products that creates psychoactive effects. So THC can create a high. It can create addictive type of properties where people get a high and then they become addicted because they want to experience more and more of that. And then THC also can create psychoactive effects where people may sometimes have hallucinations or other kinds of effects. So medical marijuana has a much larger amount of THC, and that's why it has potentially addictive side effects or psychoactive effects. I'm certainly not opposed to the use of medical marijuana because I do find it very useful in a number of patients. But basically, CBD oil has 0.3% THC or less. And so while medical marijuana is a controlled substance, CBD oil is not considered to be a controlled substance, and people don't need a marijuana card or a prescription per se, because CBD oil has such a low amount of THC that it doesn't require a prescription, is not considered to be a controlled substance. There are some questions in terms of that with the DEA or the Drug Enforcement Administration, but at this current time, it's not considered to be a controlled substance and can be used and sold legally in all 50 states. So that's just a little background, and I do find CBD oil very helpful in a number of patients with chronic pain. So in terms of CBD, that's one of the things that we'll be talking. And so this is a patient, and we'll just be bringing her on the line. So, and then there is a question over here. Someone asked, Sunny asked, how do we treat gout? And so basically, I mean, that's getting a little bit more into specifics because there's, of course, a number of conditions with chronic pain, gout included. So I'll just talk a little bit about that just to answer your question, Sunny. So how do we treat gout? Basically, I mean, so most people are familiar that gout can be brought on or triggered by certain types of foods. And so meats, seafoods are a common one. And that's something that is usually talked about in conventional medicine as well, dietary change. So primarily trying to decrease meat and seafood, and then also alcohol in the diet. However, some people don't realize that a high intake of sugary foods and processed foods is also associated with an increased risk for gout. So it's not just the meat and the seafoods and alcohol, but also avoiding a lot of the sugary and the processed foods as well. There are some questions in terms of certain types of vegetables. However, the Mayo Clinic finds that high purine vegetables, according to their research, does not seem to increase the risk for gout. And then I also use a number of Hawaiian herbs, so herbs that are used in la'au lapa'au or Hawaiian herbal medicine. So I do use a number of herbs, including koko'olau, uhaloa, noni, and so there's specific ways that we prepare it, but I do find those very, very helpful for gout. And so I use koko'olau both internally as well as if gout is really severe, where there's redness or inflammation or swelling, then we will often have people soak their feet in a cocoa tea as well. So I do find that helpful. I had one patient with gout that was really, really severe. They actually thought that he might have a blood clot in his calf because or in his leg, because his leg was so swollen. It was really, really severe. So he actually had swelling in his feet, all the way from his toes all the way up to his hips, both sides. And they ran all of the tests on him, and it just turned out that it was really, really severe gout. And he had had gout flares for a number of years. He had been to see an Ayurvedic practitioner, and he'd seen a number of other doctors. He had tried all the different pharmaceutical medications for gout, and his gout was so severe that he just wasn't, he wasn't getting any significant relief from them. And so we saw him and started working on dietary changes with him, because I think that hadn't really been emphasized enough in his care with conventional medical doctors. So we really worked a lot on dietary change, and then we also did a very aggressive treatment with Hawaiian herbs using koko'olau and noni and a number of other herbs. All swelling in his legs went down, all the inflammation. He had pain in all of his joints from his toes all the way up to his hips. So basically hips, knees, and then ankle, and then all the joints in his feet were really, really sore. So after a number of weeks, the pain and the inflammation started to go down, and eventually it completely went away. And we followed up with him. We did a phone call a year later, and a couple years later, it never came back. And he also permanently changed his diet, so he didn't go back to his previous dietary habits. So I think that's just an example of, that's just one example of, how natural medicine really can help in that particular situation. So, yeah. So hopefully that answered your questions. I saw that Sunny made a comment. We're working on dietary changes to work in progress. If there's a flare-up, can something be used instead of resorting to prescription medication? So like I said, I do use the Hawaiian herbs, and I find those really helpful. So also cherry extract. So cherry juice is helpful in terms of reducing the levels of uric acid. So that's another thing that can be helpful. Sometimes if people have issues with blood sugar, then we'll use like sour cherry extract in capsule form, because cherry juice can be pretty high in sugar. So yeah, so those are just some of the things that we use. So just to let you know, we'll be bringing Donna on, but after that we'll be wrapping up, and just want to remind you that we do offer a no-charge phone consultation. If you want to talk with me personally about any health concerns that you have, again, the personal health strategy session is very easy to arrange. You just call our office, 808-425-2987, and let our staff know that you're interested in a no-charge phone consultation. So again, I invited one of my patients to join us today. Her condition is quite serious. She has a number of conditions. So I'm going to just describe some of those things. She's dealing with a lot of different things. So she has a number of diagnoses, lacunar stroke that she had in the past. That most of you wouldn't know what that is, but strokes type of symptoms. Orthostatic hypotension, where blood pressure tends to go too low, diabetes, arthritis, and a number of other things. Some of the symptoms that she's dealing with are really severe fatigue, vertigo, double vision and blurry vision, dizziness, chronic cough, headache. She also has breast lumps and severe breast pain that's still being investigated in terms of the cause. Unexplained weight loss, where she's losing quite a bit of weight, bloating, enlarged lymph nodes in her neck and under her arm. She also has a number of digestive symptoms, so alternating diarrhea and constipation, heartburn, difficulty swallowing, skin itching, hair loss, and then also chronic hip pain from arthritis. So she recently had a brain MRI with IV contrast dye, and unfortunately, she recently had a very very bad reaction to the IV contrast dye. So she developed a headache after the IV contrast dye, flushing and burning in her head, and that burning sensation goes down her arm, and that has actually persisted, even though the IV contrast dye with the MRI was administered. I believe it was a couple weeks ago. And she said the only thing that's really helped her headache is the CBD oil. So we'll get, again, more details. And she has also, they found that she has an enlarged spleen, granulomas in her lung, pancreas, and liver. And so we found good success with acupuncture, but she recently moved to the mainland. And so I've recommended CBD oil for her, and that has helped her quite a bit. And the reason I recommend CBD oil is that when it can help in terms of pain, but doesn't seem to have the nasty side effects on the liver, as I mentioned, like with ibuprofen, acetaminophen. I've given CBD oil to probably several hundred patients at this point. We've monitored liver enzymes, and I've never seen an elevation in liver enzymes or any issues with kidney function in any of the patients, even patients who are actually on extremely high doses of CBD oil. And so in terms of the safety studies, they seem to be very good in terms of CBD oil. And because it seems to help decrease inflammation, it seems that it may actually be helpful in terms of liver function rather than having adverse effects on liver function like many pharmaceutical drugs do. And because it can help to decrease inflammation, it can get to some of the source of some of the causes for pain. So let's go ahead and then let's just get Donna on the line right now. So, okay. Go. So we're just going to be we're calling Donna right now. So. Hi.
Hello.
Hi, Donna. Hi. Okay. Well, thanks so much for being involved in the Facebook Live today. So, yeah, so I have a few questions for you. So now that I've described, your situation, I just wanted to ask, have I described your symptoms correctly?
Oh, yeah. It was, I'm hearing this on my iPad. So, yeah, so I have a few questions.
Oh, sure. Yeah, we might have to have you actually turn off your your Facebook Live feed, because I think the sound is we're getting some feedback through that. Okay. Okay, yeah, sorry about that. So, okay. Yeah, could you tell us a little bit more in your own words in terms of your symptoms that you're experiencing?
A lot of joint issues, and now my stomach, I'm having a lot of issues, which with that also comes pain. And through the inflammation, I've had that quite a bit more. And then my breast pain, it is still some bumps. But when I they had me taking ibuprofen, medicines like that. And but when I tried the CBD oil, I found that it helped more with stuff than what I had really set out, and that was just for pain, and that was so much so my bones and joints. But my headache, I've been having a reoccurring headache since I had this last MRI, and so that's my CBD oil. And I mean, it was probably within 2 to 3 minutes. I had done something else, and it was like, wow, my headache's gone. And then within minutes, it starts helping with the bone and the joints. And I am now seeing a difference in some of my inflammation with using that versus, some of the other stuff.
Yeah, that's great. And are you still having to use any pharmaceutical pain medication at all?
No, zero.
Yeah, that's great. Yeah, especially with some of the concerns with your organs and liver and so we're trying to do everything we can to avoid having to use any pharmaceutical pain medications because of concerns with some of your organs too, right?
And then my endoscopy, which is that I had an extra amount of pills and some type of mucus like this was kind of giving me like I'm having trouble swallowing, and then with that kind of black acid reflux. And so I usually don't have to use my CBD every day once I finally got taken it. And so all of my results that I just had are still pending. I was at the gastrologist today, and I do have something else different with my liver. I had to change, and there is something else in my stomach. So I'm waiting on the actual pathologist reports. My polyps were pretty malignant, which I guess everybody must be like that because everybody's told me that it's okay. But I'm waiting for the results for that. But I'm just glad I don't have to add any other medications because everything really bothers my stomach. So I have this one thing, and so I don't have to worry about all of the other side effects because I already have enough stuff going on.
Yeah.
And so, and it helps with my nausea. A lot of times with eating or just smelling stuff sometimes, but it also helps with that.
Yeah, no, that's great. And I will say I found that to be the case in a lot of patients with chronic digestive conditions where they have nausea, that I found CBD oil to be helpful for that as well. So, yeah, and I know that, before you moved to the mainland that, you were here and, we did acupuncture and massage. And then what was that like for you?
Well, it was very eye-opening because I had never had acupuncture before, and I guess maybe I'm like a lot of people. I didn't know how that was going to be, but with the oils, and then after, even with the first treatment, I could feel a difference, and the pain, it helped me immensely with pain as well, and I also, how you taught me with the pressure places and stuff where I'd had the acupuncture and it would last. It wasn't just something as soon as I left the office, it went away. No, it was lasting, my neck especially. But I do. So, I miss it so bad. I just wonder how I would feel if I could be getting the acupuncture to go along with, my other treatments and stuff. I really miss that.
Yeah, I know. Very sad when you had to move to the mainland. It was like, oh gosh. I know, because I wish I could be doing acupuncture for you too. So, yeah. But yeah, I've been hoping that you would find a good person over there. So I guess if anyone out there listening has recommendations for good acupuncturists in Tennessee, we'd welcome you sending that along. So yeah.
Well, I would just like to add that I hope that anybody that's listening, that will seek a different. I have gone to so many different doctors and as many specialists as I have gone to. When I came there to y'all's office, it was, well, first of all, it was unlike any other experience. But treating the body as a whole and not just one thing, and that, I think that's what helped me significantly was getting all of that addressed. It wasn't like having to wait on this or wait on that. And with the acupuncture and those type of other implements like with my CBD oil and massage, it just really made a great impact on me. But just to try a naturopathic, especially if you use other conventional methods and everything, I mean, I really wished I could get you to Tennessee.
Yeah, I know. I know. So, and then is there, before we end, is there anything else that you wanted to share or say, for the people listening?
Well, I know that people are skeptical about a lot of different things, and I was too. But I always too, it's not one wrong. You take something for this, you take something for that. But for me, even with strokes, the strokes that I've had, I have a big concern about things that affect your blood pressure, anything like that. And then too, the heart rate with orthostatic hypotension, I had my blood pressure goes real low, but the heart rate just goes real fast. So over the counter medicines and even some prescription medicines, the least amount of anything that has side effects or anything that can affect those parts, I want to stay away from, and I have to be cautious. Even if I do, have to do something. But I would just say, to try the CBD. I'm sure that it's different for everybody, but when somebody has chronic pain from the time they get up, like I had been doing, and not having absolutely no relief other than a bunch of more side effects, this was just really, really helpful to me in my treatment.
Yeah, that's great. Yeah, because I mean, it's just such a drain. I mean, people, don't realize the effects that chronic pain can have. I mean, because it's not just physical, but I mean, like, mentally, emotionally, it drains you too, and so it's just like, and I mean, it's all, I've had some people describe it as being, kind of like you have these chains on you that you're dragging around all the time, that it just kind of slows everything down. And it's just, I mean, it can just be extremely taxing. So, yeah, so I'm glad that we found some things that can help you, with that. So, okay. Well, thank you, Donna, for joining us. We really, really appreciate your time.
I really appreciate you having me. I wish I was actually there back in the way. But yes, and I appreciate everything you do and everybody there at the office. My little friend Caitlin there and Stuart and them, and tell everybody a big hello and a big mahalo for all that they do for me. I know I get on their nerves sometimes.
Oh, no, you're fine.
I'm really glad to be here today.
Yeah.
I really appreciate everything that you do and for all your other patients.
Yeah.
So, yeah. Mahalo.
Yeah. Well, thanks, thanks, Donna. We're so happy to have you in our lives too. So, yeah, thanks. Okay, well, we'll go ahead and hang up and then say aloha here. And then you could probably turn back on your Facebook Live and then watch the rest of it. So.
Yeah, I'm already.
Okay. Yeah. Okay. Yeah, great. Thanks, Donna. Take care. Okay, bye. Okay. So again, we really want to thank Donna for her time and sharing her experience, because I think it's really helpful for you personally to hear, for those of you that are listening, for you to be able to hear, just people's firsthand experiences, because I think it's different than hearing it from me. So I do want to share that Donna's condition has been a drain on her financially. So we helped her put up a GoFundMe campaign to raise funds for her treatment. Most of you don't know her personally, but if you can relate to her situation, I know she would be deeply grateful for any contribution that you can give, even if it's small. So we've pinned her campaign to the top of our Facebook page. So if the spirit so moves you, please go to our page and then check out her story. So again, thank you for being here. I appreciate the opportunity to let you know about the natural medicine approach to treating pain. And if you'd like to arrange a personal health strategy session or no-charge phone consultation for people who are interested in talking about a medical condition with me, again, it's really easy. Just call our office at 808-425-2987, and you'll also find the contact information on our Facebook page. Mahalo, and we'll see you in 2 weeks. Aloha.